Hello everyone! In this video, we are going to explain about the important parts you need to know about scoliosis. What is scoliosis? Scoliosis is a sideways curvature of the spine that most often diagnosed in adolescents. This is the example of people with normal bone looks like, and this is the example of people with scoliosis looks like.
What are the causes and factors that lead to scoliosis? Neuromuscular condition. This condition affects the nerves and muscles. They include cerebral palsy, polymyelitis, and muscular dystrophy. Congenital scoliosis. This condition was present at birth, occurs if the bones in the spine develop abnormally when the fetus is growing. Specific genes. At least one gene plays a role in the development of scoliosis. Leg length. If one leg is longer than the other, an individual may develop scoliosis. Syndromic scoliosis. It can develop as part of the medical condition, including neurofibromatosis or Marfan syndrome. Osteoporosis. It can cause secondary scoliosis due to bone degeneration. Other causes: poor posture, carrying backpacks or satchels, connective tissue disorders. Some injuries can cause spinal curvature. What is the risk factor? Age. Signs and symptoms often start during a growth spurt just before puberty. Sex. Girls have a much higher risk of the curve worsening and requiring treatment. Family history. It can run in families, but most children with scoliosis don't have a family history.
For example of your case, there is a 15-year-old female with adolescent idiopathic scoliosis and back pain. This is the example of the X-ray. And this is the example of clinical photos demonstrating deformity.
Scoliosis signs and symptoms. Early onset scoliosis is a curvature of the spine that is diagnosed between the age of 8 and 10 years old. There are several things to look for when screening for early onset scoliosis include 1. One shoulder appear higher than the other. 2. Trunk and ribcage shifted to one side. 3. Arm hand unevenly straight next to the body. 4. Head appear off center between the hips. 5. One shoulder blade is more prominent than the other when bent over. Adult scoliosis is actually oftentimes begins since they were teenagers. First, there is an increased rate of low back pain, as well as occasionally fatigue in the muscle if there is loss of ability to stand and sitting upright with the curvatures. Third, reduction of the height due to a curved spine. Fourth, pumping into the lower back. Fifth, numbness, weakness, and cramping down the leg from the nerve impingement. And lastly, shortness of breathing caused by an upper spine curve.
Scoliosis treatment. The scoliosis treatment used depends on the type of scoliosis, the extent of the spinal curve, and the risk of curve progression. 1. Scoliosis braces. Adolescents switch a curve between 25 degree and 45 degree, and pre-adolescents switch a curve greater than 10 degree are candidates for a bracing. A big brace does not correct scoliosis, but instead helps slow or halt the progressions. Thoracic lumbar sacral orthosis (TLSO) braces are familiar to people with lower back pains. The most common scoliosis braces is the Boston brace and Charleston brace. Number 2. Physical therapy. Physical therapy and exercise are often used to supplement treatment in patients even for mild scoliosis which curve less than 15 degrees. Physiotherapy scoliosis-specific exercise (PSSE) are used to correct posture, strengthen muscles, improve breathing, stabilize, and straighten the spine. Number 3. Scoliosis surgery. Surgical options include spinal fusion, Spinal fusion surgery is used to correct spinal curve greater than 45 degree in adolescents or 15 degree in adults. To correct the curve, spine surgeons will join or fuse some of the vertebrae together using bone graft from the hip or other parts of the body. Surgical options include expanding rod. If the scoliosis is progressing rapidly at a young age, surgeons can attach 1 or 2 expandable rods along the spine that can adjust in length as the child grows. Surgical options include vertebrae body tethering. This procedure can be performed through small incisions. Screws are placed along the outside edge of the abdominal spinal curve and a strong flexible cord is threaded through the screw. When the cord is tightened, the spine straightens. Number 4. Pull therapy. The body's natural buoyancy in water helps counteract the effects of gravity, enabling patients to condition muscles while putting less stress on the facet joints. Number 5. Psychosocial support. The psychological and social impact of scoliosis can be serious, particularly for adolescents, and these impacts are often overlooked. Behavior problems, depression, low self-esteem, and social isolation are common. So, social scoliosis require both family and psychosocial support. Number 6. Casting. In infantile scoliosis, a doctor may use plaster casting instead of resins to help the infant spine grow into a typical position. Number 7. Nutrition. Anti-inflammatory foods or nutritional supplements may help address the inflammation. For example, turmeric and ginger as a food that have been shown to have anti-inflammatory qualities. Drinking water regularly, such as 8 glasses of water throughout the day, is also important as it will help keep the spinal disc hydrated. Scoliosis medications. Number 1. Analgesics. Analgesics are medications that relieve pain. Patients with degenerative scoliosis may experience more pain than other people because of the underlying disc degeneration rather than the scoliosis curve. Number 2. Other medications. Acetaminophen or ibuprofen, prescriptions NSAIDs, and in rare case, opioids may be prescribed to relieve the back pain. This picture shows the best medication for scoliosis include the standard dosage and common side effects. Number 3. Injections. Epidural steroid injections can reduce inflammation, while facet block injections can block pain signals from reaching the brain. Steroid injections have the ability to provide pain relief for up to several months.
That's all from us. Thank you.